I want to thank Irene and the CKON for making time again to provide you and the listeners with an update. And I hope all of you are continuing to do well today. I do want to mention again that we are streaming live on our MCA Facebook page. And as Irene has already outlined, questions are only going to be taken by calling CKON at the 575-2101 or 358-3427. It's been now 13 weeks in our community since we declared a state of emergency for Akwesasne. I do want to acknowledge that dealing with this pandemic and practicing all of the necessary precautions, especially the social distancing, which continues to be in place, has been challenging for all of us. And I do want to say on behalf of the Mohawk Council of Akwesasne, Yamagoa, to everyone who continues to practice all of the recommended precautions in our fight against the spread of the COVID-19 virus. As for today's discussion, I want to provide information on the resumption plan for the MCA, the current operations of council and Mohawk government staff, and the pandemic guidelines for community businesses. So the MCA is currently in the process of continuing to resume operations on a gradual basis. To ensure that precautions are set in place, we will be taking for the safety of our employees and the community members. Our resumption plan started with being implemented on June 2nd, 2020. At that time, all MCA managers were mandated to physically return to their workstations. Since then, MCA managers have made the necessary plans for the return of staff, which is taking place phased throughout the month of June. Managers have ensured that social distancing measures are able to respect and that to be respected, and that the physical workplaces are able to accommodate safe practices. A full list of our services that will be available is being prepared, and we will share it on our MCA Facebook and website very soon. It is important to note that some of our services will not be resuming at this time. On Monday, June 15th, this past Monday, the first phase of frontline staff physically returned to their workstations. Right now, they're focusing on receiving training on the returning to work expectations, cross-training with other staff within their programs, cleaning their workstations, and repairing their offices and the front entrances of their buildings in order to provide services to you, the community. The second phase, which will be our final phase of frontline staff, will be physically returning to their workstations, taking place on Monday, June 29th, 2020. The MCA plans to reopen offices and resume providing services to the community on Wednesday, July 8th, 2020. We will be operating under a new normal. You will find that some services may be delivered differently. Some buildings may no longer be open to the community, and some services may no longer be provided. Throughout the month of June, we'll be taking all necessary steps to ensure that our employees and community members are protected when we reopen in July. What I've laid out to you is our tentative plan, which is subject to change. This plan can be stopped, paused, or altered if it becomes necessary. It's important that our community members continue to exercise all the safety precautions put in place to limit the spread of the COVID-19 virus. As an update on the current operations of council members and the Mohawk government staff, the district chiefs have begun operating on a rotating basis out of the administration building number 2 to ensure that physical distancing is respected. Mohawk government staff is available starting this week to answer questions and to assist community members. The Mohawk government office can be reached at 575-2348. Cell phone numbers and email addresses for council members are available on our MCA website at akwesasne.ca. Just type Contact Chiefs into the search bar on the akwesasne.ca website and the information will be displayed. As well, you can call our offices for that information. At this time, Mohawk government is working to keep physical interactions with community members to a minimum. Community members are asked to call in and the staff will do their best to assist you over the phone. If absolutely necessary, documents can be processed through a pickup and drop-off bins located in the lobby of the building. I have been operating on a continual basis throughout the pandemic, relocating as needed. For most of the past 13 weeks, I was located at the Untitled Chapter Health Facility in order to be closer to the Emergency Operations Center. As of 2 weeks, I've relocated to the administration number 1 building, the A-frame, and I'm working setting up a permanent office in this building. Plans are underway currently to relocate the Mohawk government office to the downstairs of the admin 1 building, with the touchdown station being used by the district chiefs on a rotating as needed basis, with physical distancing as a priority. The staff of Mohawk government will continue to be available to assist the community. District chiefs will be working remotely within their own districts. If you need to contact Mohawk government, it's 575-2348. If you need to speak to any member of council directly, you can use their email addresses or cell phone numbers. It's the best way to contact them, and it's the reason this information is being provided on our website. All of the emergency measures have been put in place in Akwesasne are still in effect. We are still in a state of emergency due to the COVID-19 pandemic. And as a community, we must remain vigilant until there is a vaccine. It's important that we don't rush or let go of our safety measures, or the fall could be hard and unforgiving. Community members are asked to continue to adhere to all the preventative and protective measures, including the community curfew and the recommended travel radius. Community members are required to stay home and off the roads during the hours of 10 p.m. and 6 a.m. and to otherwise remain within the 50-mile, 80-kilometer radius of Akwesasne. Community members who travel outside of the recommended travel radius are required to quarantine if they have symptoms, or isolate if they have developed symptoms for a period of 14 days upon their return to Akwesasne. For the safety of our entire community, it is best that we not travel outside of the recommended travel radius during the state of emergency. Every business that is operating within the community is required to take a number of reasonable steps to protect your employees and customers as part of our combined effort to stop the spread of the COVID-19 virus. These are protective measures that require the use of 6-foot spacings on the floor, and advising customers that this is required throughout the business and especially at the checkpoint. And that's extremely important, the physical distancing. Stagger the number of people entering premises at a time in order to respect physical distancing. Again, do not allow for lots of people to come in the stores, and that people should wait until the doors are cleared to be able to come in. Provide plexiglass dividers at checkouts and any other areas that require employees to be close to a customer. Provide hand sanitizers or washing stations to employees, and disinfect high traffic areas such as door handles, phone switches often. Provide signage at the entrance and throughout your business to remind customers of the importance of physical distancing, and have loose items at the takeout concession such as stir stick, straws, napkins, and only dispensed by food handling equipment. Complying with these requirements is vital to the ongoing health and safety of our community. We anticipate and understand the cooperation of all community businesses at this time. Reen, this is everything that I wanted to cover with you and the community this afternoon. I am open to take any questions that you or the community would like to ask.
All right, thank you very much. Again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict. For those of you that are online and you do the Facebook deal, Mohawk Council of Akwesasne is streaming this interview live on their Facebook page. And, of course, right here, the audio on 97.3. This is CKON Wednesday to Justanna. We're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict. Just presenting some information on MCA's Resumption Plan, those pandemic guidelines for community businesses, and the staff update on council itself and also Mohawk government, how those things will be set up. So we do have a question from a listener. They would like to know, will the Mohawk Council of Akwesasne be offering monetary relief to band members under a similar system to the tribe? We're familiar with CERB, but we don't qualify. What relief, if any, will be coming from the Mohawk Council of Akwesasne?
Great question. So the CERB is available to some members who qualify of our community. As we have said in the past, no employees of the Mohawk Council have been laid off. So all employees of the organization continue to receive their regular earnings. Anybody who is affected by employment loss should examine if CERB is available. At this time, there is no plans for any direct benefits to the community, but every case or every situation that may not qualify for certain benefits is a case by case that we can assist in trying to find solutions for the community member.
All right, so the next question. The Siverages Mohawk tribe received $16 million based on tribal enrollment numbers. Have or will you speak to tribal chiefs? So have you or will you speak to tribal council with the Siverages Mohawk tribe to see if the tribe will give assistance to tribally enrolled members living on the northern portion of Akwesasne? And this listener feels that they counted us in their numbers but won't give us assistance. What can you do as Grand Chief?
Well, I think that let me say that we do have a call with the tribe every week right now with the tribal leadership to talk about the current curfew or the travel restrictions or other community concerns abroad. So we have that call regularly with them. I have read the same information that likely the community member has, that there has been some resources provided to the Siverages Mohawk tribe in response to the COVID-19. As far as I know, they're not providing any direct stipends or payments to the community members with any of that monies. Now, we have at the Mohawk Council have received some additional resources as well in response to the pandemic from the federal government and from the provincial governments. That money has gone to supporting the food distribution that we were doing earlier on in the pandemic, as well as the guarding initiative that the Mohawk Council undertook. So those resources were being used to support those programs, also being used to support changes in some physical changes within the organization to accommodate the social distancing, as well as ensuring that the community is safe. We can talk with the tribe to see what some of those programs may be that we can jointly work together on. But I think that those resources are being used to provide programming to the community. They do have programming that is not restricted by the border, but it is an option that we can have a further conversation with you.
All right, Grand Chief, I would like to make you aware they released the information late this morning from the Siverages Mohawk tribe, and you can find it likely on their website, Facebook, and also on the CKON Facebook page. The tribe made reference to the monies that they received from the CARES Act and those federal relief funds dispersed to the tribe. They can only cover certain things. So I believe that they are making at least one-time financial distribution to the tribal member identified as head of household and shall be intended for food, shelter, and other household needs. Another direct payment will go to their broadband, another direct payment to their electricity provider, free air conditioning if that's appropriate, and also direct payment to the head of household's fuel account. So that's what they're going to be doing with the distribution of disaster relief funds through their particular avenue, and that's through the CARES Act, U.S. Treasury Department under the Coronavirus Aid, Relief, and Economic Security CARES Act. So that might be what our listener is referencing. And again, that was released late this morning by the Siverages Mohawk tribe. I just wanted to share that with you.
I appreciate that, Reen. And again, it's something that we can have a conversation with the tribal leadership about, but understanding as well that we still continue to have our workforce receiving their regular salaries. If there are persons who have been affected financially by the COVID-19 pandemic, they should be looking at some of those other benefits available through Canada. But there may be some other options that we can look at as well.
All right, great. We're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict, and he is open to any questions that you have. 518-358-3427, 613-575-2101. They are streaming this audio live on the MCA Facebook page and I'm sure you'll be able to watch it afterwards on Facebook, and MCA is also on YouTube as well. So I'm sure that for those of you who might just be tuning in, you'll be able to watch it on those platforms. We also plan to re-air this interview right before CKON Radio Bingo on Tuesday, June 16th. So, again, if you have any questions, they have to be phoned into the radio station. You cannot put your question on the Facebook comment section of that live streaming audio. The only way you can get those answered is by calling the radio station. So we appreciate our listeners who have taken the time to do that today. And I do have some more questions for the Grand Chief. So, Grand Chief, are you aware or do you have any information of protocols and guidelines for hosting a wedding in the fall?
We have been using the Eastern Ontario Health Unit as the guide for practices here in the community. Currently, which they work in partnership with the province of Ontario. Currently, the restrictions for outside funerals and outside weddings have changed. Every service provider is required to follow certain guidelines as well, whether it be a church or the banquet centers, places like that. I encourage persons who may be interested in, or who may be getting married or having those celebrations in the fall to contact the provider now to see what is available to them. If there are ones happening in the community here outside, they need to be ensuring that there's ample space for people to be social distancing. There is, numbers of that, there is restrictions on the number of people that can gather for these sort of events. That's something that, the family has to be conscious of as well. And these are all in place for the safety of them, their guests, and the community at whole. And people really need to be ensuring that they're following those guidelines. They're not there to stop people from celebrating certain events and having a good time. They're there to protect all of us as a community. So I encourage them to do a bit more research. And when they do make the announcement on that date, that they're very considerate of those requirements.
Well, I know that with this whole COVID-19 pandemic, things change day by day. With the phasing and the reopening of some businesses in phases, as we mentioned, and different stipulations. Yesterday I think they announced, as for an example, in New York State, up to 25 people now can gather, kind of deal. So there's so many different changes every day. Something changes. So it's hard to keep up with those things. And hopefully we're in July, right? We're in June right now. So fall, we've still got a few more months to get to. So hopefully those things, people will be responsible and do the social distancing, do the mask wearing, if you feel it's appropriate, and something for you and your family to keep us safe and to keep yourself safe. That those things are incorporated. So, again, we're talking with Grand Chief MCA, Mohawk Council of Akwesasne, Abram Benedict. And another listener wants to know, why are some community members being cut off from their community support program benefits if they received the CERB? Are you aware of this? And if not, the listener wants to know, will you investigate and ensure members get their assistance from the community support program?
So we have on some of our updates on the radio here with Urine have talked about the CERB benefits and who not is qualified for those benefits. It's extremely important that people who have applied for them ensure that they are in the, that they were qualified for them. What we do know is that the federal government has said that, persons who would not have who would not have been qualified for them and who have received them will have to pay that back. So my understanding of how the community support program works is that if a client has a source of income while they're on community support, that amount is deducted from their benefits. So if they are receiving X amount of money and they receive additional monies from somewhere else, whether it be from CERB or from a source of income, meaning they got a job during that period of time, it is deducted. So That's likely what has happened, that person, may have received a CERB, so therefore that for the amount of time that, that money should have lasted for, it likely can be deducted from their benefits from the community support program. The community support program has said that they will work with clients on a one-on-one basis. If you accidentally applied for those benefits, they will assist you in going forward. So if that's the case for any of our community members, I encourage them to reach out to their caseworker and have a conversation with them and figure out what is the best course of going forward.
How are we doing with our testing, Grand Chief? Have we upped those numbers at all? I know that that's been something that a lot of the premiers and the governors and, federal governments and stuff, that's one of the things that they want to see is more testing so that we can know where we are data-wise and act appropriately with regards to reopening or, scaling back a bit. So looking at the testing that we do on the northern portion of the community, have we upped those numbers at all? Do you have any data on that to share?
Yeah, those, so the numbers have been pretty, quite slow. As of the last update, there was 40 tests completed. I think we're probably, averaging maybe about 10 a week. The criteria for being tested has been loosened again. Remember when we first started testing, you had to have been exposed to somebody or had to have one of the symptoms, a sore throat, a high fever, before you could be tested. Now we're pretty much at the point where if you feel that you have potentially have been near someone, whether it be out shopping or maybe you have come into the community, then you're able to go and go to call community support, or sorry, community health nurses and ask for a test. They will test you. The numbers have been quite steady, and not too many. I don't have the exact as of yesterday, but that is something that we can make sure that we continue to report to the community. Now, recognizing as well, on June 2nd, we had 40 community members who may have went to the hospital for an illness, may have been tested there, or may have called the Eastern Ontario Health Unit or hospital. They may have been tested there. So as of June 2nd, we had 40 here, and I've just gotten a note from our staff. So as of yesterday, we've had 62 in our community tested here at the Justanna mobile unit. As of a few days ago, there's been no positive, so which is good news for our community. So the numbers continue to be, people continue to come in and be tested, which is good. We want people to be tested.
Excellent. And again, we're talking with the Grand Chief. If you have a question, we usually go right up until 1 o'clock, so you still got a few more minutes to get your questions in, and I'll probably close the phone lines about 10 to 1. So if you have any questions for the Grand Chief, COVID-19 related, please, and we'll ask that for you for sure today. I want to thank the Grand Chief for taking the time to talk to us about all of the updates and to answer questions from community members and constituents of the Mohawk Council of Akwesasne. So we have a question. Is Mohawk Council of Akwesasne aware that Quebec residents with Quebec health cards cannot be seen at the Cornwall Community Hospital? And they're talking about the mammograms, ultrasounds, things of that nature. Where are they supposed to go?
I'm not in-depthly aware of what exact services are available or not available with residents who may have Quebec health cards but trying to seek services in Ontario. I do know that there are a number of arrangements and agreements we have with service providers and doctors and the Cornwall Hospital to be able to have our residents of Akwesasne, regardless of what kind of OHIP or QHIP card you have, to receive those services. So I would say that, if there are community members who are not able to access those services, to give our community health a call, and they can help navigate through that. Unfortunately, we have a number of sick people in our community, so accessing variant tests and for service providers is not out of the norm. So I would say that we have a lot of experience, not a lot, but enough experience in navigating some of these jurisdictional challenges, and they should give the Department of Health, the community health nurses a call, and they can assist with that going forward.
How are we doing with child care, daycare, with the reopening of those centers? How are things on that end, Grand Chief?
So the child care has recently put out a survey to the current clients, families that they serve, asking who still has a continued need for child care. And they're asking, where the parents work, whether it's an essential or not. Childcare has been a real, a vital service to the reopening of the MCA and providing services to the community. The staff now are surveying, collecting that data. The ministry, in which we follow their guidelines for the daycares, have issued, the requirements to open, what those requirements are. The sizes of the classrooms will be shrunk, so which means that, if we had say 70 childcare spots now, we will not have 70 going forward. We have, they are maxing out the number of children that can be in one classroom, which then just means that, there are less spots for our children to be in. So we're working, the child care administration is working on that right now, what those plans will look like, what the need is going to be going forward. And, there is a huge component as well of ensuring that there is regular sanitization of the surfaces, of the toys, that the workers are not intermingling with different classrooms, that the classrooms stay within, that class, and those kids are only exposed to those kids. Or they're only in that room for the entire day. Common areas will not be available as frequently. So all of those plannings are underway right now, as well as the analysis of the need. So as we move forward, they're looking at a potential opening date of early July, but they will be releasing that information, more information to the current families they service and to the community going forward. So we want people to continue to be patient as they work through that process to be able to open the child care centers safely for the children and for the staff that are assisting them.
And another listener would like to know, are there any updates with regards to improved internet for the district of Justanna? There were discussions of a mobile tower. Do you know of this, or do you have an update to share with the district of Justanna and their internet?
I can assure you that there are internet issues throughout the entire community, including my home on Gawanoge. This has been obviously an ongoing issue that was there prior to the pandemic. Since the pandemic has hit and many people are at home working from home, children are learning from home, people are just at home, watching, using the internet more, has really identified the gaps that exist throughout the entire community. We were successful in receiving some funding to expand fiber to our homes in Akwesasne. That project was underway already before the pandemic had hit, still in the planning phase. So we have, really put some pressure on them internally to kick that project up and get that rolling out to see what some options are. Now, I do know that a wireless access point was put up at Yohahio and Snai to assist some of the students there. We are still continuing to examine what some of those options may be for wireless networks or wireless systems down in the Justanna district to be able to provide more reliable, faster internet speed to the members there. We're really conscious of this. We're working on it, and we'll continue to keep you updated on that. But it's a really great question, and we hear that lots from the community that the internet is either not available or it is very slow, and we are working within the MCA to try to find ways to alleviate that, and as well with our partners at the service providers to look at options as well.
How are we doing with regards to Yakisata and Jiunkunusade and loosening restrictions for family members and friends to be able to do those window visits. Has that changed at all over the last 2 weeks since we spoke, Grand Chief?
Yes, it has. And I do want to say that I do want to acknowledge and say Nyamagoa to all the families and to the staff for being very patient on this. I know that every update that we've given, this question is brought forward. Our council has received several emails and calls about this. I do know that you did have the mayor on last week, and this was raised with her as well. I do want to say thank you to all of the families and staff for your patience on this. So we take the lead from the ministry as well on this, since they are the licensed provider, as well as the experts in the pandemic, and as well as the regulations. So what I can say is that as of June 18th, Yakisuta will be allowing for outdoor window visits again. And so that they are working through all of the logistics right now. There are some requirements of the family that, there will be some limitations on this. We do anticipate that hopefully as the numbers of positive cases continue to level out, that things continue to reopen, and as a community and as the region around us continues to open more services, that the threats and the number of cases continues to go down, that we can expand the visits at our facilities. So we're hoping that's the track we'll be on. But starting later this week, the families will be able to arrange window visits again, with their loved ones who have been in the facility. So I'm happy to be able to report that. And again, thank you for your patience and understanding. I know this has been extremely difficult and stressful for our families, having to do online visits and FaceTime and those things. They're just not the same. I do recognize and acknowledge that, and I do, I think we're moving in the right direction. But the decision was made to limit the risk. The risk is just too high for outbreak in any of our facilities, and too risky to our elders and our dudas who are in there. But we're restarting the window visits in the coming week.
Excellent. A lot of people will be very happy about that. And again, we can't extend our appreciation enough to all of the staff that work at both facilities for making sure that they are keeping safe for not only a family and community, but also for the residents of that home. And Yakisuta and Junganusa Day, we've got vulnerable populations that reside at those two homes, and it's a testament to the love that and the caring and the kindness that our staff at both facilities show to not only the residents, their fellow co-workers, but also with regards to the families and whatnot. So great job to the staff at both facilities. Thank you for taking care of yourself so that you're able to take care of our loved ones safely. Another comment or question from a listener. Grand Chief, do you think that there will ever come a time when MCA and the tribe will do away with the divisive language of northern portion and southern portion, when we will come together as Mohawks of Akwesasne as one? This listener says that means united efforts and combining resources and assets from the tribe and MCA to benefit all Akwesasne.
This concept has been something that has been talked about for many years, and I do believe that it is possible. One of the biggest challenges that we faced is not being economically self-sustainable as a community. And until we have achieved that, that is when, we can really start moving that yardstick on being united with the Southern Mohawk tribe and the Mohawk Council. Unfortunately, the way it is that right now we are driven by contribution agreements from the federal government And those sometimes have stipulations in there that talk about residency and specific to being in Canada, United States. And until we can be able to say, that we can support all of our community services with our own money that we have generated through, whether it be through economic opportunities or through business ventures, we'll be in a better position. But, that will take a lot of effort from the community and the leadership, but it's not impossible. It is something that is continuously talked about more and more, especially as we see that how the border, continues to affect us. In fact, right now, the Canada-United States border is closed to non-essential traffic. So essentially, the only people that is using this crossing right now is our members in our community, which just shows that, that international border just dissects directly through our community and creates lots of challenges for us, including having two separate elected governments, including the Mohawk Nation that exists here. So I believe that as we continue to move forward and make it progressive as a community, this is something that we need to embrace and start laying the framework for. Anything's possible.
All right, so I'm going to close the phone lines, everybody. Thanks for all the calls. I've still got some questions to get to, and we'd like to wrap up with the Grand Chief at 1 o'clock today. Another listener would like to share an experience and see if you have any guidance. And I know we've touched on it a couple of times, CERB, the $2,000 amount that they talk about all the time. So this listener says the $2,000 program, they received the money. They were out of work when they received the money. Now they've returned to work, and now the government is demanding the $2,000 back. This listener would like to know, is that right? Have you heard of that? I know that you've made reference to contacting community support, that anything having to do with the CERB, is that another avenue that we can, again, direct them to?
Well, I think that my comments about contacting community support in relation to CERB was specific for community support clients. So that question was around why did a community support client get cut off because they got CERB. So that they should talk to their client for that specific reason. If it was a community member who was employed and lost their employment as a result of COVID-19 and applied for CERB, and now is in the position of getting letters from the federal government saying they owe the money back, I would encourage them to call the Mohawk Council Chief's office, Mohawk government, and provide them with the particulars, and we can assist them in navigating through that, as well as the Access Center, which is formerly the Akwesasne Area Management Board, works closely with Service Canada, who is providing these benefits as well. They can be an option as well, and giving them a call. I understand that their offices opened back up this Monday, so that they are there to assist the community as well. So there are sort of options available to the community member, or any community member who may be having issue with CERB and those benefits that have been made available to them.
All right, taking a look at another question. This listener says some community members and members of the Longhouse don't give their children vaccines. Ambi and the child care daycare just announced up-to-date immunizations be required in order to return to school or to daycare child care. What is your take on this? Is this something that you're aware of? And what's your take on it, Grand Chief?
I have heard about these these challenges in the past. We do know that New York had changed the legislation a couple of years ago saying that all students had to be vaccinated, very narrow exemption area in that. I'm not a healthcare provider. I'm not a, I can't offer advice as a physician or somebody who has studied medicine. I'm a community leader who understands that, we do have practices, customs, and traditions that are part of who we are as human people. And I do understand how that affects the day-to-day of our children and the facilities in which we operate. So the ministries and the guidelines for schools requires that children, do have vaccinations. There are some exemption that's allowed for that area. I think that the best option would be is to have those conversations with the healthcare provider. I mean, it's a bit of it's a bit of a ironic time to be talking about that because we are in a global pandemic, which is a virus that attacks, the immune system, or sorry, the respiratory system, and this is what we have been dealing with since March, and in other parts of the world since 2019. So, I mean, there are vaccinations are given to children and youth and adults to prevent these sort of things from happening. But again, I mean, it's every parent's choice as to how they want to deal with those situations. We can look at what options may be available for them to attend the daycares or attend the schools. We're not saying that they can and they can't. We have to take a better look at that and figure that out. I don't have a direct answer whether or not I can make that happen, but those are some of the things that we have to work one-on-one with a community member with.
We have another listener who would like to extend appreciation for Mohawk Council of Akwesasne and Siverage's Mohawk Tribal Chiefs for jumping on this situation and for working so hard to keep everyone safe. So that is a comment from one of our listeners. Again, the phone lines are closed. We'll be wrapping up in 5 minutes. And our next question, status of schooling at Amby in the fall. Will the kids be returning to school on time, Grand Chief?
There is planning happening right now through the Akwesasne Board of Education Administration for the potential return of the students to the school in September. It has not been determined whether or not that will be exactly what is going to happen. Again, it goes back to how how our community responds to the global pandemic, how our case numbers go. But I can tell you that they are planning, for all scenarios, whether it be, from completely from home, which I think that if that situation happened, the previous question you had asked about is now solved, that everybody is being taught from home, at least for that year. There are possible options that there may be rotating schedules and some in, some out, because the physical distancing will continue to likely apply for the next foreseeable future, and that's consideration that we have to make sure as well. So there's not a definite answer been made whether or not the schools will be open in September, but all of the possible scenarios are being planned for to ensure that our children are able to receive the educational services that they need.
All right, and our last question before we throw it to you for wrap-up, Grand Chief, is Council developing procedures for a second wave of COVID-19? And this listener wants to know, what is your opinion of a second wave? Do you think it's coming, Grand Chief?
Well, I don't, unfortunately, Irene, I can't see the future, I'm not able to predict where we're going to be going, but I can tell you that we are planning for a second wave. That if it does occur, we have seen some issues around food securities. We are looking at what those may be. The schools are planning for, virtual learning. We are doing the best we can to ensure that all the services that we offer as an organization are able to be done remotely. So going forward, we're looking at everything that we have learned from the point of declaring a state of emergency. We're looking at what we can learn, what we can do better from the lessons learned, what we can learn from other places that are dealing with this pandemic and the COVID-19 virus as First Nation communities and just as service providers. So we are preparing for that in case it does. Well, let's hope that it doesn't. Because I know this has not been easy on anybody, and this has been very, there have been some very challenging times for all of us in this pandemic, but we have to be prepared for anything that may come at us, including a second wave.
And we would like to pass along, for those that missed it, late this morning, Justin Trudeau had announced that Canada and U.S. Had come to another agreement where they're going to extend the closure of the border to only the essential services and things of that nature. That was set to expire on Sunday. So they have moved that date now to July 21st for keeping the border closed only for essential services and also for the trade and commerce that occurs. Other than that, they are going to keep that border closed until July 21st at least. So, Grand Chief, we will let you wrap things up. I would like to thank our listeners, of course, for phoning in the questions that the Grand Chief could answer for you today. Thank you for offering us the opportunity for this update, Grand Chief. We do appreciate it. So, if you could wrap up for us, please.
Yes, absolutely. So just 2 points before I wrap up. It's important that community members continue to use their status cards when crossing the border so that they're able to be facilitated quicker without delay when crossing into into Cornwall or into Roosevelt Town. The other thing is that Justanna as well will be resuming outdoor visits on June later this week. And those are both for Justanna and Akwesasne will be by appointment only, so they will have to reach out to the facility to make that happen. So, Reen, I do want to thank you. I do know that we're all doing our part. It's been some challenging times over the last 13 weeks for everyone. I can't repeat enough that we must all continue to do our part and continue to socially distance. This hasn't always been easy. This will not continue to be easy. This will not be easy going forward. We have to continue to take this one day at a time and support each other along the way as we continue to fight this battle against the COVID-19 virus. Yamagoa to all of our healthcare providers, our essential workers who are working hard to keep our community safe, and Yamagoa to our listeners in our community for doing your part in keeping our community safe during these very, very extraordinary times. So Yamagoa, Akwesasne, we will get through this together.